Dear colleagues, ladies and gentlemen, thank you for attending this talk on nasal and vocal tract coupling, variation of the Velopharyngeal opening in 3D casts. My name is Miriam Havel. I'm a ENT and phoniatrician at the University Hospital of Munich in Germany. And this data is a part of an ongoing research together with Johan Sundberg from the Royal Institute of Technology in Stockholm, Sweden. So what is this about? When we talk about nasalization in singing, it's a controversial issue. However, there is some investigations that have shown and documented velopharyngeal openings in operatic singers. And there is also some data in terms of mathematical modeling and also perceptual analysis and some in vivo experiments during the last years. And what we do here is that we try to experimentally analyze the effects of variation of velopharyngeal openings on acoustical effects on the vowel spectra. So we used for this vocal tract cast 3D printouts of vocal tract in different vowel configuration, an A, an E, an E, and an U, and we coupled those to sinonasal tract model derived from the CT scan, and this was the experimental setup. Here you can see the nasal tract. It's other way around. Here's the nose, here's the hard palate, and this would be the velopharyngeal region, and this is the vocal tract tightly seated by means of plasticine, and here's an earphone which provides a sine sweep excitation which travels through the system and is picked up here by a microphone at the lip opening. And the velopharyngeal port is modulated by tubes of different sizes. The dimensions are picked out here with the length and the cross-sectional area and a ratio of area to length. And you can see that the narrow tube has a small ratio which increases with the diameter of the specific tube. So this is what we get as a response curve here on left, a row in the response curve after excitation of that system by Tombstone software, which generates the sine sweep and also records the microphone signal at the same time. And the middle panel represents the microphone-earphone combination, and combining those two curves, you obtain the corrected response curve that is quite a realistic estimate of transfer function of the vocal tract, in this case, the vowel U. So let's have a closer look at the U. And you can see the situation of closed vocal port here. So the area to length ratio in this case is 0. So this is the vocal tract of the vowel U in isolation. And let's have a look what's happened when we attach a narrow, very narrow VPO tube to this. So you can see some effect here that are going to be more pronounced with a wider VPO tube. So you still have more and more effects of the coupling with the nasal tract when you widen the tube. Clearly seen here in the lower frequency region, where the first formant peak travels up in frequency. And there's also some effects here in a high frequency region. The dip that we think that is caused by the nasal tract itself seem to be quite shallow here. So let's have a look at the other vowels. Here's an overview of all vowels measured: vowel E, vowel E, vowel U, and vowel A. And in those three, vowel E, and A, you can see a quite marked dip here in a lower frequency region, which is more pronounced when the VPO is increased. Also in this case, you have some effects on the high frequency region as well. So this is to demonstrate the systematical effects of the coupling with the nasal cavity by different VPO sizes. And another interesting aspect of this would be the effects on the spectrum balance. As we know, the spectrum balance is of great relevance for both speech and singing, and the effect of VPO on this level, on this balance, can be measured when we look at the at the level of the first form and peak here, and compare it to the highest form and peak in the high range between 2 to 4 kilohertz. And you can see the level difference here is 26 decibels. And when you look at those effects in the transfer function, which is obtained after coupling with a large VPO tube, you can see a level difference of 18 decibels. So this is a clear effect of boosting the high spectrum partials. So when we talk about this, we can also look at the other vowels. And this is another presentation mode for the change of level difference with varying coupling tube dimensions. And you can see clear effects in vowel U and vowel E, and also some effects in vowel E, and very, very small effects for vowel A. So this is, of course, a hard-walled cast, so the situation in vivo is completely different, because we have vibrating walls and mucosa lining, which produce a lot of losses. And we also know that the VPO shape and the nasal anatomy vary a lot between individuals, but also intra-individually. But nevertheless, we were able to see some systematic effects as the VPO dip, which was quite marked somewhere between 500 and 600 hertz. The shallow dip in the vowel U may be related to the difference in the distribution of the standing wave, which is quite narrow in U and wide in other vowels. So we see some effects in the variability of the VPO size, as what has been observed already in a study from Berg and Sundberg, and we also could find some enhancement in the high frequency spectrum partials as an effect. It also has been observed in long-term average spectral analysis of sung vowel sequences. So we see some effects in terms of dip, and also in terms of boosting the high frequency, and think that the nasalization may be used as a means to enhance the high spectrum partials. And we would like to thank Professor Head&Neck and Dr. Traza for providing the 3D imaging and STL files for the vocal tract printing. And also, I would like to thank you for your attention, for attending this talk.